Every year, leading nonprofits in the Bay Area provide mentoring to students at Stanford's Graduate School of Business. The student serves on the board of the organization as a non-voting member and gets in-depth exposure into how a nonprofit board operates. In return, the board fellow brings a fresh perspective to the table and often works on a consulting project as well. Family Service Agency, FSA, is one such organization that joined the Center for Social Innovation's Board Fellows program. FSA hosted 3 MBA students in past years, leading to successful outcomes. Lori Wishard is president of FSA, a 59-year-old organization delivering services to people in San Mateo and the surrounding areas. Like many other nonprofits, her organization does not possess in-house business expertise.
Most of the people that are on our staff have a background in psychotherapy, social work, case management, child development. So the kind of work that the fellows have done for us is to kind of do a real good of analysis of the economics of specific kind of trouble spots in our organization.
FSA serves over 19,000 people a year, from newborn babies to elderly citizens. Its mission is to empower people, those characterized as the working poor, to achieve self-sufficiency. With 185 employees and an annual budget of $7.5 million, FSA continues to look for ways to improve the efficiency of its services. That's where board fellows come in. Sean Tia was a board fellow with FSA in 2006. Wishard and her team were grappling with the challenge of figuring out how to deliver high-quality early childhood education and care to low-income families in an efficient manner. Years of experience in child care had shown them that one must have the right configuration of staff, space, and group size to deliver optimal care. Too many children, and an organization could fall out of compliance with licensing. Too many staff members, and the cost of the organization could be significant. Wishard describes how Sean tackled this problem.
What he helped us do is he constructed a model so that we could, change the numbers of children, change the numbers of staff, change the size of the group, and sort of see what the effect of that was financially. So we were able to run that through in terms of looking at our current programs, but it's also a tool that we use as we go forward to evaluate any new programs that we might start.
FSA also provides services to families affected by contentious divorces, substance abuse, or domestic violence through its Family Visitation Center. Here, a non-custodial parent can visit a child, or a child can be transferred from one parent to another. FSA ensures that the people involved are supervised and kept safe during the visitation period. Wishard wanted to examine the staffing, schedule, and other parameters that affect the efficiency of the center. 2 new board fellows, Blake Adams and Stephanie Wilson, were tasked with providing recommendations to help FSA make adjustments to their current program.
They came out here and they observed situations, so they really knew what was involved and what this service actually was. And then they looked at our usage of putting together staff and parents and rooms and came up with some recommendations about how we might deliver, more service for less cost. And that's been very useful.
Wishard and her board are already looking forward to working with the next Stanford Board Fellow. They want to get a similar blueprint for the Elder Care Center.